This is a video I should have made a long time ago. It's about how I hurt my back, what I did in the healing process to get back on track. I was deadlifting with bad form. This is before I started getting really into being very technical and nerdy about form. Eventually caused a hernia to form in a disc between L4 and L5. Now, the way I did this, I think, is essentially I didn't understand the leg drive aspect of a deadlift, and I was just pulling with my hamstrings and lower back. Essentially, I was doing a stiff-legged deadlift for every single max attempt and heavy deadlift day. Stiff-legged deadlifts are fantastic when prescribed proportionately to your regular deadlift. Uh, a lot of people say, hey bro, how much did you pull today? But the deadlift is actually a pushing exercise if you understand how to properly deadlift. At least the first foot off the floor is all leg drive. I mean, that's the reason why the bar should break, is knee extension. Anyways, I didn't understand any of that, and I just put so much stress on my lower back that eventually I just wore that disc down. I have the MRI to prove it, and you can see for yourselves. So that's the first mistake I made. I just didn't have proper technique down. If you are deadlifting on a regular basis and you are interested in getting strong in the deadlift and you're somewhat unsure as to whether or not you're deadlifting properly, go seek out a coach. I mean, just for one session, a professional coach can make a world of difference and save you from doing this same exact thing. Second biggest mistake, and I really want to drive this home, is re-injury. I think it's pretty typical in our culture for us guys and girls, but most of us men, we from a very young age, we're taught to just kind of walk it off and tough it out. Don't be a pussy. Get in there, suck it up, and just hope that the pain just goes away. But people who study pain will tell you that that's usually not a good idea, and we can train ourselves to feel more pain. So what they're finding out, and this is my retarded way of paraphrasing things I've read, is a lot of pain is not physical. Like, it's not related to an injury. It's related to how we've wired our brains. So let's say there's an injury. There's an actual mechanical malfunction in the body, like in the tissues of the body. It's fucked, nerves are severed, whatever. There's actual physical there's a physical response to pain. But then if we live life like the tough guy who tries to tough it out and work through it, in my case, keep deadlifting and keep squatting heavy, and then keep re-injuring it and keep feeling that pain, then we're going to start wiring the brain to experience pain with anything related to those activities. And over time, your body will heal. Maybe it won't heal totally correctly, but it will heal. It's always healing. It's just trying to heal all the time. But you'll still have the pain, and that's what chronic pain is when you've healed, you're no longer injured, you're not bleeding, the bone isn't broken anymore, but for some reason when you do that activity, you feel pain. And this is where they're starting to discover so much of chronic pain is psychological. And so much of arthritis as well, that being a form of chronic pain, is a result of an injury not being properly cared for and recovered and healed. When you injure something, especially in a joint, right? And your back is a series of joints. When you hurt a joint and then re-injure it, you don't allow it to heal, or just barely heals and then you re-injure it again, same exact injury, over and over and over again, you will eventually develop some type of arthritis. And then you have arthritis that comes after, a trauma, physical trauma too, which is called post-traumatic arthritis. And I think I have some form of that, or just some form of self-afflicted chronic pain, because I just kept going in there and trying to tough it out and max out the next week after hurting myself. And then the same injury happened. I had the same experience, flash of light, sharp stabbing pain, saw stars, all that shit. So it would happen when I squatted and deadlifted. And for the longest time, I refused to accept that I was injured. And I kept going in there and trying to load up the bar and do the lifts, only to leave the gym hunched over, holding my back and being really pissed off at myself. If I had not done that and actually rehabbed the injury, I probably wouldn't be talking about this to you today. Not that big of a deal, but it was a big time waster. I didn't really get back into a proper rehab protocol for probably 18 months after the initial injury. So for the first couple of months after the injury, I just didn't do anything about it. I would keep going back to the gym and re-injuring myself. And then I was like, this ain't gonna go away. I need some help. I went to see a doctor, in a hospital. He wanted to give me medicine. He was interested in doing some type of surgery. That wasn't going to happen. Apparently, doctors don't really know anything about sports injuries. They don't study biomechanics. They're not familiar with the term stress recovery adaptation. And telling you to get back in there and just lift smarter is kind of a liability to them. So don't go to a doctor for a sports injury unless your bone's sticking out or you're bleeding. You need a bone that needs to be set and put in a cast. Like, they're not really going to be able to do much for you, especially for the back. We don't really know a lot about backs. I went to see acupuncturists, massage therapists, chiropractors. I mean, it felt good, but it didn't do anything for me because that's not how you heal a herniated disc. The way you heal a herniated disc is you let the body heal it itself. It's always in a healing process. Remember that. Your body's always healing. You just have to get out of your own way. So in my case, I just shouldn't have been trying to deadlift and squat heavy. Instead, I should have done the rehab process that I eventually discovered. So eventually I stumbled upon a website called healaherniatedDisc.com. It's not up anymore, but the information was very, very simple. It was one page of text, a few pictures. There's nothing for sale. There was no email list to sign up for. It was awesome. I don't know who posted it. Dude, if you're out there and for some reason you're watching this, thank you so much. So much of my understanding of how to rehab, not just a back injury, but I've helped people with shoulder injuries, elbow injuries, knees, hips, whatever, all the big joints. I've helped people with the basic concepts of what I initially discovered on that website. Your disc is going to heal if you allow it. And what you do while it's healing is very important. Make your life more ergonomic, meaning obviously you're not going to go into the gym and keep re-injuring it, but at home you don't want to be exacerbating the injury. Again, we don't want to train our brains to associate certain activities, certain movements, or whatever with pain. We don't want to train our mind to anticipate pain, because that's what chronic pain is. So make your life more ergonomic. In the case of a lower back injury, you can't sit for long periods of time. So if that's you, stop sitting around. That doesn't mean you have to sit with perfect posture, because that won't help, but just don't sit for long periods of time. Don't sit long enough to feel that burning pain in your lower back. If you work at home, if you work at a computer like I do, you're just gonna have to get up a lot and move around before you sit back down. Things like bending over and tying your shoes, very fucking painful. Any kind of hinging at the hips and bending over and putting a lot of load on your spine is just not going to feel good ever, especially while you're recovering from a new injury. So you're going to have to throw your foot up on the table and get your foot real close to you and tie your shoe like that. And then lastly, very important thing, and this is kind of what the STAR rehab protocol is, which you should research and learn about if you anticipate on hurting your back, or if that describes you, is you need to strengthen the big supportive muscles that surround that injured joint. So in the case of a lower back injury, that's going to be strengthening the erector spinae, those big muscles that run up the sides of your spinal column, and your core muscles. So basically, deadlifting and squatting, right? Especially deadlifting. So in the case of a lower back injury, a movement like a very well performed Romanian deadlift will build strength in your erectors and your abdominal muscles. Now, if you don't know how to perform that movement to the standard of what it should be at, then again, you need to consult a professional who can teach you how to do that. If you don't know how to brace your abs and keep intradiaphragmatic pressure all the while keeping your lower back in extension when you go into a Romanian deadlift, then don't do this protocol. Don't try to rehab. Just be like everyone else and take painkillers. But if you can afford to hire a professional to teach you how to do this, then you're probably going to recover just fine. The rehab process goes like this. You're in the gym. Let's say you do something dumb and then you feel a snap or a pull or a strain. You feel really sharp pain. It gets all locked up and you know you're just done for the day. Just leave the gym. After about 4 days, by the way, don't panic, okay? You knew you were going to get injured at some point. You signed up for this. You decided you want to get into weightlifting and strength training. So don't complain about it. Don't fucking panic. Please don't panic, okay? And you're going to go back into the gym about 4 or 5 days later. You're not going to be feeling great. You're not going to be feeling strong or whatever. And you need to go in there and you need to test the movement, okay? So let's say you hurt yourself while deadlifting. You're going to go into the gym and you're going to see if you can just perform a normal hip hinge, okay? So basically a deadlift without any weight. Just see if you can do a hinge and then test the range of motion. How far into this hip hinge can I go without allowing that pain I feel to exceed like a 4 out of 5? Basically just a dull pain that doesn't move around. It's just stabilized. It's local to that one spot where we hurt ourselves, and it's not intensifying, okay? You might find that you can use a normal range of motion. You also might find that you can only go halfway through it. Whatever it is, make a mental note of it, okay? This is like if your range of motion is limited due to the pain, respect the pain. It's there to help you. But you need to make a note of it. Okay, this is where my range of motion is on day 1. I expect to see some quantifiable improvement in this from workout to workout, or at least from week to week, okay? So let's say you're the guy who can only do, a half deadlift, basically a Romanian deadlift that goes halfway down. Maybe you can only get to the bottoms of your kneecaps. Fine, that's day 1, that's your day 1 range of motion. Okay, so you tested your movement, you found that you can do the movement, and you found what range of motion that you can do the movement with. Next, you need to find out how much you can load it for your first workout. So if you're doing the STAR rehab protocol, I think it calls for sets of 10. So you need to find, with your range of motion, how much weight you can do for sets of 10. Now, this should not feel like a max effort set of 10, okay? If you're familiar with RPE, it shouldn't really feel like more than, say, a 7 RPE, okay? Find a weight that you can use with that new range of motion for 7 RPE. And that's your starting weight, okay? Find your weight, find your range of motion, okay? You might be using some weird variation of the lift, but that's fine. It's similar enough to your normal lift. You're going to get a lot of carryover benefits, and it's going to eventually lead you back to normal training. And that's really what it's all about, okay? You're gonna train with this very respectful amount of weight and range of motion, keeping pain stable. You don't want your pain getting worse. If your pain's getting worse, you're doing something wrong. You need to reassess the situation and change some variables: loading, volume, range of motion, exercise variation. You need to find something that works, that allows you to train. Slowly titrate the weight up from workout to workout while allowing the pain to stabilize and eventually decrease, okay? You want to see it at least stable, but you do want to eventually start seeing it decrease. Don't go in there expecting not to feel any pain. That's unrealistic. You need to go in there knowing that you're going to feel some pain. This is a rehab. This is not fun. Suck it up. Know that you will feel pain, but do not allow it to increase. You want to see it stabilize. Now, if you're going in there and your pain is not stabilizing and it's actually getting worse, then stop trying to rehab and go go talk to an actual sports therapist or someone who is studied in medicine and biomechanics and training, and they can help you a lot better than my advice here. Okay, but you get on that process. You're going to study the STAR rehab protocol. Basically, you're just going to very, very, very slowly, gradually, very patiently work back towards normal training. Okay, and once the pain is pretty much gone, and you're moving weight that your former strong self was moving, well, then now you know that you can start training normally. Now, if you're like me and you injured yourself and you basically gave yourself chronic pain or some type of post-traumatic arthritis, then you know that you're just not going to be able to train like everyone else is. You might be a good lifter, you might be very technical, you might have a very a wise understanding of weightlifting and form and programming, but you should also know that you may not be able to recover as quickly as someone who doesn't have arthritis or chronic pain. So just keep an eye on that. Temper your expectations a little bit. You may not be able to put up the same amount of training volume as the guy who's the same age as you, but just he never had that injury, so he might be able to do more sets per workout than you. He might be able to deadlift more often than you, and because of that, he'll get stronger faster than you. But that's okay. You're going to be patient. You're going to play the long game, and you're going to think about making strength improvements like in year-long increments. Like while your friends are like, I'm going to deadlift an extra plate in 3 months, like you can have the same goal, just maybe in 12 months. All right, just slow it down, because you can re-injure this thing and basically like spur the process all over again. That's all I have. I'll see you later on here.